It's time to play America's favorite game show, Myth or Fact.
Let's play myth or fact. The flu shot causes the flu.
Myth.
Correct, Omar. The flu vaccine is safe and it's a good idea to get vaccinated. You might get sore, maybe a bit red, but that disappears in a day or so.
Join us next time for Myth or Fact. For more information, visit FightTheFluLA.com.
The 1918 pandemic flu was the worst in recorded history. Over time, there has been over 300 pandemics when we look back through historical medical records, but 1918 was certainly the most severe that we had seen in recent times. And the effect on the community was severe. We lost 500,000 Americans in that year, much more than we lost in World War I and any other sort of natural disaster that has come since then. We saw in 2009, the H1N1 started in North America and Mexico, and the first 2 cases were identified in the US. So right here in this country was the epicenter of it all. I think the experience of the 2009 pandemic is a great stepping stone, I guess, in terms of where we need to go and how we need to prepare for future pandemics.
It's time to play America's favorite game show, Myth or Fact.
We're here with Lynn and Rudy to play myth or fact. Let's get started. Myth or fact? There is no way to prevent the flu.
Fact.
I'm sorry, Rudy. That's a myth. You can prevent the flu with the vaccine, covering your cough, washing your hands, and avoiding sick people.
Join us next time for Myth or Fact. For more information, visit FightTheFluLA.com. It's time to play America's favorite game show, Myth or Fact.
We're here with Camille and Omar to play myth or fact. A pandemic flu outbreak is handled just like a hurricane.
Myth.
Correct. You'll need to stay home to reduce the risk of getting sick. Schools and businesses may be closed. Have 2 weeks of supplies that include water, food, and prescriptions.
Join us next time. For more information, visit FightTheFluLA.com.
It's important to prepare for the pandemic flu for multiple reasons. In terms of the community, each time we have a pandemic flu, as suggested, it's a new virus, we're not really sure when it first breaks out who it's going to affect, the severity of it, the morbidity and mortality. Again, a pandemic suggests it's a new virus, so that means many, many more people are going to be sick at one time than just the seasonal flu time. Many more people will be susceptible. And what the fear is, if it's a very severe pandemic flu, if a lot of people in the community are sick at the same time, it's a huge burden on our healthcare community. We may have staff shortages. We may take public health measures such as closing down schools, alternating business schedules, and affecting our daily lives beyond what we see in a regular seasonal flu. But overall, I guess you can sum up in several different points. One is to do what you do for the regular seasonal flu, some of those very basic precautions. Stay home when you're sick until you're free of symptoms for 24 hours. If you're a healthcare provider, if you work with young children or people who have immunocompromised status, so basically putting you at a higher risk group in terms of spread, or the people you deal with, we advise those people to potentially stay longer at home and away from others who may become sick. So one important item is to stay home if you're sick. Number 2 is to be prepared to take care of yourself at home. So what do you need? The very same basics we use for seasonal flu. Have some tissues, have some good vitamin C, some fluids to rehydrate, get plenty of rest. Many healthy individuals wind up doing just fine staying at home and taking care of themselves with the flu. But others, such as pregnant women, very young children, again, those who have other conditions, should call their primary care provider and potentially get an appointment for further evaluation.
It's time to play America's favorite game show, Myth or Fact.
We're here with Camille and Lynn to play myth or fact. Myth or fact? Only older people need to get the flu shot.
Myth.
Correct. People with health issues like asthma, diabetes, heart disease, and kidney disease need to get a flu shot. As always, check with your doctor.
Join us next time for Myth or Fact. For more information, visit FightTheFluLA.com.
I think one of the most important things the community needs to be aware of is what do they need to do to prevent themselves from getting sick? And if they do, how do you prevent the spread of the germs? It's important to realize that before one actually has the symptoms of cough, fever, sneezing, that they may be shedding the virus while they're still symptom-free. So imagine that I've come to work today and I shake hands with my boss and with some of my other coworkers, and I actually get infected with the virus as I take the secretions, rub my eyes, and so forth. Well, I may actually have the disease within me, and over the next few hours, I may start shedding the virus through my secretions, through my eye secretions, through my mouth secretions, and not really still be quite sick or know it. When you meet someone new in the business setting, you reach out your right hand and shake them, and there's the transmission that occurs. And so it's difficult, to really judge. I don't want to offend the other person. I don't want to seem cold. What do I do? And certainly we've seen this new culture of fist bumping, elbow bumping, of other types of things that may not be so appropriate for the more formal settings. But I think that may be something that the public would be willing to accept. Once you are sick, there are certain measures you want to take to prevent the spread from you. And so when you're sick and you're coughing and sneezing, what was recommended in 2009 H1N1 for future pandemics is to cover your cough. One technique that was displayed was covering your cough by sneezing or coughing into your arm, and so bringing the elbow and trying to protect yourself. One idea behind that, as opposed to just using your hands, is again, you use your hands to open doorknobs, and potentially that could spread the germs to other objects. So this would be one recommended method. Certainly having ample tissues, paper towels, and other objects would be advisable so you can cough into that. But in the absence of those, coughing and sneezing into your arm is one method. And again, we're talking about handshaking, whether you are sick or whether you're healthy. The number one thing that people can do to prevent themselves from getting sick or from spreading the flu is hand washing. In some office settings, we may see that they have alcohol sanitizers, or that necessarily in other places, you may not have access to running water and soap. And certainly alcohol sanitizers is a wonderful alternative, but the friction of the contact that you have when you do actual soap and water hand washing can prevent the spread of the flu in many ways.
It's time to play America's favorite game show, Myth or Fact.
Lynn, Omar, let's get to it. Myth or fact? Pregnant women should not get vaccinated.
Myth.
That's correct, Lynn. Pregnant women should get the flu shot. But as always, check with your doctor. Lynn, you zoom into the lead.
Join us next time for Myth or Fact. For more information, visit FightTheFluLA.com.
When the vaccine becomes available, it's important to go ahead and become inoculated. Now, who should get the vaccine? We saw with 2009 H1N1 that emphasis was placed very heavily on young children. In general, whether it's seasonal flu or the pandemic flu, the following people need to definitely get the vaccine and may be offered at an earlier time than the rest of the community. The group at highest risk, pregnant women. It's important for a pregnant woman to get the shot because a flu shot, as of this year, cannot be given to children under 6 months of age. It has not been tested and approved. So for pregnant moms, especially those in the latter parts of their pregnancy, get the shot. They may actually be able to pass on some immunity to the fetus. Other folks that may be at risk are those who have medical conditions, such as, again, heart disease, lung disease particularly, or any other sorts of conditions affecting the kidney, the body, that may put them at a higher chance of suffering from complications. Other individuals include healthcare workers. We still have a challenge in our community with regular seasonal flu to get all of our healthcare workers vaccinated at all levels, whether you are a physician, a nurse, whether you simply work at a hospital as a support individual, you need to get vaccinated because you're coming into contact with many people who could develop complications from it. What healthcare providers will need to do at the onset of a pandemic is certainly listen to the Office of Public Health for guidance and direction. The Department of Health and Hospitals Office of Public Health will be working very hard to do surveillance to see who is getting sick, what kinds of treatments would they require. So at the initial outset, it's important to listen for clinical guidance. They will need to make sure they're fully staffed, they have the appropriate medical supplies, they're aware of the testing that needs to be done. The best method is to start from top. We get a lot of our direction at the state level from the CDC. So going to the CDC website, www.cdc.gov, and some of the guidance they provide in terms of pandemic preparation. They have been an incredibly useful source, and even at the very local level, I feel that our providers can get some useful lessons from them. The state thereupon builds on the CDC plan, and we have also in the Office of Public Health come up with some templates where providers can use to do the planning for their particular office. So I would refer them to www.dhh.la.gov. That's the Department of Health and Hospitals website, and they can find links to planning for the hospitals, planning for primary care centers, and so forth. In 2009, a new website went up, www.fighttheflula.com, which had provided, again, providers with up-to-date statistics on the number of cases, hospitalized patients, number of deaths, and more current guidance, again, linking back to the CDC website where providers can get more information on it. So those may be three potential sources where they can get some great information on pandemic flu planning.
It's time to play America's favorite game show, Myth or Fact.
Myth or fact? Pandemic flu and seasonal flu are the same. Rudy is first on the buzzer.
Myth.
Rudy, you're right. Pandemic flu is much more severe than seasonal flu. The symptoms are much worse, affects more people, and schools and businesses may close.
Join us next time. For more information, visit fighttheflula.com.